My dear postgraduate students, first things first. In this class, we shall be dealing with the histology for pathology concerning duodenum, jejunum, and ileum. On the screen, you people are seeing the gastrointestinal tract. Of course, the stomach is not over here nor the esophagus. But then I am able to see the C-shaped duodenum followed by the jejunum, ileum, and the colon. Now, the problem is how to histologically distinguish these structures. If it were a slide or a specimen for us. Any of the gastrointestinal tract will be having such a structure. As I had been telling you people, there will be a mucosa, then the muscularis mucosa, the submucosa, followed by a muscularis externa and the serosa. In this case, I am finding that the mucosa is thrown into folds. Rather, I am finding piles of these villi-like structures. These are obviously meant for two reasons. One, to increase the secretory surface, and two, to increase the absorptive surface. Lower down, we will be having the crypts, and then these efface as glands. I hope it is clear to you people. Let me not waste this picture. I am able to find all these blue ones are the basal nuclei. There is the tall columnar epithelium with eosinophilic cytoplasm. Some of the cells are appearing empty to be the goblet cells. And this is the duodenum. There are very many things about it. We had been mentioning the mucosa. Then there is a submucosa, which has got a varied pattern of glands called the Brunner's glands. Villus means a finger-like extension. There is a muscularis externa, and then there is a muscularis interna also. So this will be the serosa, which will be having the blood vessels and the nerves and the veins, which supply and drain the region. So this is a fundamental one. Duodenum will be villi and then Brunner's glands. This is a basic concept of the small intestine. There is the epithelium, as I had been mentioning. It is generally a low columnar epithelium. There is a typical brush border. Brush border in the sense it is not cilia, but then microvilli to increase the absorptive and the secretory surfaces. This is the wonder part of it, namely the lamina propria. Whatever be the type of epithelium, it needs a support. And this is the loose fibrous tissue, which is usually not seen, which will be the lamina propria, and it will be having lymphocytes. These tubes are nothing but the fibrovascular core that I am seeing coming from the vessels over here. So this, of course, is the muscularis layer. There is an inner circular, outer longitudinal. Nerve bundles can be seen in between. Generally, they are seen in between the circular and the longitudinal muscles when we look for them, the Auerbach's plexus, etc. I hope the structures are clear to you people. If not, look at this. So it is a three-dimensional picture, very beautifully drawn. And there are the villi lined by the epithelium and the central fibrovascular core, the lamina propria that is infiltrated with the inflammatory cells, and this will be the muscularis mucosa and the submucosa. Jejunum over here has got tall villi, whereas the ileum is relatively short. And I find that it is going more into a kind of a reabsorption rather than a secretion. Lymphoid follicle is diagrammatically depicted over here. This again from the regions of University of Michigan Medical School. There is a tubular structure, namely the gastrointestinal tract, which has got a circular lumen. There are the villi which are being projected. This is being diagrammatically shown over here. There is the central fibrovascular core over here. There is a smooth muscle that is supporting it. Lower down, the villi can be going in the form of crypts, and these will be emptied into by the glands. These are the duodenal Brunner's glands over here. This is what I had been saying. If you take one particular cell, they have got multiple small villi-like structures called as microvilli or the brush border, which is again shown over here. This is what you people are seeing in these pictures. So I would like you people to kindly appreciate the absorptive surface, the microphotograph of these, the microvilli in these pictures, and the electron microscopy of the same. Jejunum, as I told you, it will be having a slightly taller epithelium and villi. So I'm finding the epithelium is also tall enough, and I'm finding empty basket cells called the goblet cells. Their main purpose is secretion, the goblet cells. The glands of Leiberkuhn are seen over here. The muscularis mucosa, submucosal coat is over here. Very loose, fibrous tissue. And there is a circular muscle over here. And if you observe carefully, there are multiple dark dots. They are the lymphocytes or the inflammatory cells, which are commonly seen in this region. Hats off to Chapman Histo. A wonderful series for the students to benefit from. Kindly subscribe to this. Here, I am able to see the intestine, and these are the villi, the mucosa. The small intestine or the ileum intact, it has got these well-circumscribed structures called the lymphoid follicles. Lymphoid follicle means I am finding some pale areas, which are the immature cells in the center, and some darker rim, which are the mature cells in the periphery. They are called the Peyer's patches. Overall, you find that they have got an oval kind of an outline, which is important in some pathology. So what are the differences between the duodenum, jejunum, and the ileum? Serosa, they are all similar. And muscularis, almost similar, except for the Auerbach's plexus. Brunner's glands, maximum in duodenum, minimum in others. Muscularis mucosa, there is no change. No Peyer's patches except in the ileum where there will be Peyer's patches. And the intestinal epithelium, columnar goblet cells. Villi are longer in the jejunum, villi are shorter in the ileum than the duodenum. The other things we need not go in. This is a wonderful one. You find that the function will be varying. We shall be seeing it under various pathologies. Again, a beautiful H&E stained slide. I am finding the tall villi over here. Then most important will be the Peyer's patches of lymphoid follicles. Very diagrammatically depicted. You can help your students to draw the diagrams if the need arises. So there is a mucosa, there are Peyer's patches, muscularis externa is over here. Between the two, there is a submucus. All the parts have been very well labeled. So you have got a surface epithelium, there is the lamina propria, fibrovascular core, then there are the lymphoid follicles or the Peyer's patches. There can be the glands over here, the crypts, that is what we call. They are the inroads into the underlying tissue. There is a muscularis interna and the externa. Interna will be over here, externa composed of inner circular and outer longitudinal. And this is the serosa, very loose connective tissue, which will be having the blood vessels and the lymphatics. So,